number 2 or 3, it doesn't matter. We are talking about coronavirus and what's the difference between coronavirus and influenza or a flu. There is many debates around this topic, and if it's just a flu or if it's just a coronavirus. There is also some articles commenting that there was about 9,000 cases of a flu deaths in America, which were eventually coronavirus. So, if it's coronavirus or not, compare the flu. Before I start, please guys, share, like, subscribe, comment, and ask for a video. I am happy to create it for you, okay? So the first difference between the influenza and coronavirus is that it gets transmitted faster and it have a shorter incubation period. At least that's what they're saying on the Russian informational social medias and journals and so on and so on. So the number 2 difference is that the main factor for the flu is children. Children are the ones that transmit the influence to the parents, to the grandmas, and so on, right? Instead of that, coronavirus, it's quite the opposite. The children get it from the parents. So adults are the ones that get the children ill. That's number 2. So number 3, there is a lot of debates about diagnosis, how you can be, and that you can be ill and or still having the virus and transmit it to others, but not suffering yourself, not having any symptoms, which is something very different from influenza, because if you have influenza, you cannot hide your symptoms, right? Okay, so the risks they have, the flu come from the children. They believe that coronavirus is more easily to go to older people, but this is not confirmed yet. The risk also for the flu are pregnant women. For coronavirus, this is not confirmed that it's like that. Quite the opposite. They believe the pregnant women and the children are less exposed. Older people get the disease. To children for the influenza, older people are more exposed to coronavirus. Instead, the children are the ones that often suffer from influenza. For the influenza, there are vaccines as well as pneumonia, and there is also a treatment and so on. For the coronavirus, there is no vaccine. There are similarities, very serious similarities, and I'm gonna just comment them like that. You have to be ready to talk about these things, repass your vocabulary on your target language, okay? The symptoms are the mechanism of transfer is air or dropway, we already know that, or direct contact, or using of utensils and so on, or contact or airdrops. The same or similar ways of being contagious or getting ill. Regarding how get transmitted, you could check on the description box above. There is a small link. I create a video especially for that. What is the flu, pneumonia, and coronavirus symptoms with slightly sharp dry coughing on coronavirus, which are only, again, this is only not proven information, but this is what is the information that we have right now. temperature, shortness of breath, fever, headache. You gotta repass those, okay? We have a lab information that somewhat Russian researchers or Russian TVs divulge this information and talk about it, that especially the scientists and the doctors talk about it, that they find out that, as you guys remember, I show you I don't have it here, it's in the other room, but I did show you the painting, my painting of coronavirus, which was having protein spikes around the cells, which make this cell accepted by the body cells of the individual, of the human body. So what they find out, that this coronavirus cells, before enters to any other cells, use this protein, through which get attached to the healthy cells. So first of all, she get attached, the coronavirus cell get attached to the healthy cell like this, using these protein spikes. The healthy human cells accept it because the protein is what the cells need. This protein is called ACA2, and this protein is naturally located in the lungs, in the cardiovascular system. So the body does recognize it and does accept it. So this protein helps or support the blood pressure regulation function. So this protein is the path or the key to the coronavirus to get inside the healthy body cells, okay? What they find out, that this protein is more active or more present in older people, which make the older people more vulnerable, because this protein is more developed, more active in people after certain age. Okay, and this is one of the explanation that they offer as why coronavirus it's more easily, or why the older people are more exposed, or it's more dangerous for them. They're talking about different methods and how not to spread. Unfortunately, I'm not gonna go in detail and comment all that, but this protein, what's make it so unique, ACE2, is that this protein is different in different individuals. It has different activity in different ages, okay? So because of that, they cannot find exactly mathematical proof what make older people being more exposed or less exposed, or what exactly is the particularity of this virus, is that there's so many unknown facts yet. Talking about what if we continue living as we used to live up to now. So I just want to clarify something, guys. A lot of people take the quarantine as some kind of a deadly punishment, and they don't understand why is this happening. The quarantine, have its reason. The reason why they put people in quarantine is in order to avoid all the people to get ill at the same time. The reason why is because if all the people get ill at the same time, there will be no hospital, no oxygen, there is no hospital capacity to accept so many patients. So as we talked on the previous video, even though we don't have a vaccine, the patients are observed in the hospital and eventually they receive oxygen if they need to. Okay? But if we keep living without the quarantine, without the rules, without being careful, there is a risk that everyone can get sick at the same time. If everyone gets sick at the same time, there is no facility, no possibility, social possibility. Hospitals and clinics, there is no way, they don't have this capacity to accept that much of a patient, right? So what the beliefs are, because the prognosis that everyone will get sick, that's they believe, that's what they're talking about, that everyone eventually will be exposed, eventually will get sick. The belief is that 80% of the people will not have any serious symptoms, they will not suffer, they will not have a respiratory problems, they will only be like instrument, like transport, they will only transport this virus. So these viruses also, they're naturally created in the body, so they believe that 80% of the population are going to be sick, but they are going to only transport this virus, right? 15% will need oxygen. Only 15% is gonna need oxygen. And in order to avoid all of this percentage to get ill at the same time, this is why it's quarantine. And only 5% will really, really need a serious hospital care they will have a severe problem with breathing and so on and so on and so on. So there has not been discovered a vaccine yet. We explain why the elderly are at risk. Okay, that's why they said keep the older people at home and make them have as less contact as possible. I don't know if you guys work as an interpreter, but I personally in the past week called many older people, and the doctor suggests them to consultate over the phone, not to go to the doctor's office. Also, another risk factors, if you have a medicines, if you take blood pressure and so on, no smoking, no heavy drugs, of course. There is different and many kind of comments that the alcohol help, that the cocaine help, and so on. This is of course very funny, but of course if you don't work and you have nothing else to do, you drink a drink or two or so on. None of this has been proven. That was my update about coronavirus and flu factors. And again, guys, stay home, stay safe, be careful with whom you have contact. I send you hearts. Please like, share, subscribe, comment, press the bell button so you'll be notified when I create a new video. Thank you for being here. I hope you are safe and positive and healthy. Have a great day. Bye bye.